Hi, and welcome to the Eagle Connect program for healthcare administration and public health. We are going to have a great panel tonight, and we have some wonderful experts in their field who are here to share their experiences and give us some advice on networking and finding next steps in our career. So I want to thank you both for joining us virtually this evening. And we're going to start ladies first. So Cassie, if you don't mind introducing yourself, letting us know a little bit about where you went to school and a little bit about your background professionally and what you're doing now.
Thank you for having me. I really appreciate it, and would be happy to do this again. But my name is Cassie Prather, and I am a public health director at Woodford County Health Department. But I got my start in public health as a result of getting an undergraduate degree, a bachelor's degree in health promotion with a minor in agriculture, which is not a combination you see a lot. But it actually, the ag classes that I had, the science courses, enabled me to go from a health educator at Montgomery County Health Department. That was my first job out of college. And I also was able to do my internship there, which turned into a job, thankfully. But a few years after being a health educator, I became a health environmentalist. And that's where my bulk of public health experience is in. I did public health inspections, restaurants, pools, schools, you name it, for about 12 years. And in 2015, I earned a master's degree in public health from Eastern Kentucky University. And soon after obtaining that degree, I started applying for public health director positions in Kentucky because I was not only interested in the environmental health side, but I was also interested in all the different things we do in public health, whether it be in the clinic or in administration, health education, the HANDS programs, dental health programs, school health programs. I really have a passion for public health, and I felt like I would be better able to serve a community in a public health director role. So I started here in Woodford County. I've been here for 3 years now in this position, and I love it. This is what I was meant to do. Even during COVID, I feel like I'm exactly where I'm supposed to be.
That's awesome. Thank you so much. And it's really nice. So, as everyone knows, Midway University is settled within Woodford County. So I know that a lot of what's going on our campus is, being directed and encouraged and coached through your all's office, and it's doing a great job and it's keeping us very safe. So thank you for that. Okay, I'm going to turn it over. Bob Bush, go for it.
Well, Cassie, you and I have kind of interesting backgrounds that are very similar in that I have a degree in agricultural economics. So agricultural economics can lead us to different things. I graduated from Michigan State University. My degree, similar to yours, it was very, it was flexible where you can do what you want with it. So in my first part of my career, I was in the hospitality industry, managing private clubs and things like that. Before I got into healthcare. And I've been in healthcare over a couple of decades and kind of worked my way through healthcare, starting in the marketing area and physician recruitment, then moving into practice management, and now moving into my role presently is the practice administrator for a large multi-specialty group in Austin, Texas. So worked my way through that, been involved with a lot of different associations. When I was a physician recruiter, I was very involved with the Association of Staff Physician Recruiters, which is a national organization that helps hospital-based physician recruiters become more knowledgeable about their trade, be aware of all the legalities associated with physician recruiting. And again, it was very involved with them in a couple of different committees, and I was elected to their national board. Then when I got into physician practice management, I also got involved with that association, which is the Medical Group Management Association. Again, it's served on multiple different chairmen of different committees. And basically, MGMA is another opportunity for educational opportunity for practice management people, and they have the body of knowledge which everybody has to be certified on, and you can get certified as a medical practice executive, or you can have a fellowship. So when I was a physician recruiter, I was a diplomat of that, and now I'm a fellow in the medical group management, American College of Medical Practice Executives. So worked my way through the different aspects of healthcare, and a little bit similar to what you, and we both can tell COVID stories if we get asked the questions, and how it's changed our lives and how we think about things. And it's nice to talk to people without a mask on. So yeah, and again, I'm pleased to be invited to be part of the panel, and looking forward to this evening.
Awesome. Thank you for that. So one of the things that I love that you both touched on is how your degree set you up without giving you a direct path, which I think is so interesting, and that both of you all found multiple different niches in your industry. And so would you all mind expanding a little bit about that, of once you got into your big industry, how did you start to learn about all the different options, and how would you recommend someone who's about to take that first step, coaching them on navigating to their second step?
You want ladies first?
Oh, okay. So here's been my take on entering into the workforce from the get-go. Obtaining as much knowledge as possible from every position. You might come in on the bottom floor, but there are going to be things that you're going to learn from being on the bottom floor, whether it's answering phone calls or whatever. You're going to be able to build upon that. So again, I don't want students to get frustrated out of the gate if they don't land that dream job, because it's likely that that dream job might be a few years away, but they are building their resume along their path. And so, actually I can say budget cuts in public health in the recession actually forced me into working in different areas: assessment, accreditation, policy development, and things like that, because they needed somebody to do those things. And at the time I thought, oh my goodness, I don't know that I can do anything more with my time here. But I was able to learn things that I use now every day. So again, I feel like just seizing every opportunity to absorb as much possible knowledge, is to your advantage. Again, whether it's answering phones and improving your skills with dealing with the public, anything like that. Just, I feel like, don't get discouraged. Again, if you don't get your dream job right out of the gate, you can get other jobs that are going to build your skills in order to land that dream job one of these days. So don't get frustrated and keep on working toward your goal.
That's awesome. And before we move over and get Bob's take on this, Cassie, can you tell me a little bit about, for you got an internship. Many of my students hear me talk about how an internship is going to be vital for them figuring out what they want to do and what they don't want to do. What do you remember from that initial internship, what you learned, both that helped you take steps forward and maybe sideways?
That's a great point. I'm glad you asked that question. And I was actually going to say, for beginning students, if you think you want to do one thing, I would highly suggest shadowing someone in that position. But again, when you start out in a job that might not be what you thought it was going to be, that you're still going to be able to learn things that are going to help you with the end goal. But with my experience, I just lucked out that when I got my internship, it was actually 600 unpaid hours. So that's a long time to spend with an organization. And I reported every day, just like the other employees. And I was involved in many projects because at the time, actually somebody had left on maternity leave and that person did not return. And so it ended up creating a spot for me. So I really looked out, and I was blessed in that way. But again, internships are great. Even though they're unpaid, they are worth their weight in gold. And again, just not getting frustrated. I can't reiterate that enough. Just not getting frustrated with not getting your dream job right out of college.
Thank you. Yeah, those beginner jobs really help us build the dream, and realize sometimes that the dream job is not a nightmare, and we want to pivot some other direction.
Yes.
Yeah. Okay. So Bob, what is your take on that question and that information?
Okay. Yeah, no, I think it's one of those things where we have to be nimble. I think one of those things that everybody needs to do, I think I agree with Cassie, is that you don't think that you're going to walk into your first job and have that big corner office. You need to start at the beginning and be prepared to work hard and be nimble. The thing that I remember, and I really am impressed when people are curious. They're always asking, can I get involved with something else? Can I do something else? What else can I do to help? So curiosity, helpfulness, being nimble to say, okay, this might not be my job, but I'll learn what I can do and help out and go forward. It's one of those things. And when I first started in hospitality, my first jobs, you always did something, you did entry level. That's what, I was a bartender and waited tables and answered the phones and as a host and you do all the things you do to learn the business. I think that's what you said. It's like you have to learn the business, and so you start picking up different things. You'll realize what you enjoy and what you don't enjoy, and then you can kind of angle your way into the business that way. It's amazing what happens when supervisors see somebody who is putting an effort out to learn more things and still doing their job, but who wants to get involved, who wants to know more, wants to do a better job and be more valuable to the company. Those are the people that you go to first to say, hey, they're going to get a better raise than everybody else because they're putting all that extra effort in. And then also it's like, okay, if there's an opportunity for them to be moved up, they're probably the first person that comes to mind because of all the effort they put in helping out of everybody else.
Yeah, I like that. Jump in, get your feet wet, volunteer early and often. Yeah, I love it. Okay, wonderful. So one of the other things that I think is really important and something that we stand for and hold highly valuable at Midway University is becoming lifelong learners. And so both of you all are in industries, and both of you all have had to learn a lot very quickly about a brand new disease. But outside of that, because I'm going to ask you a COVID question because we have to, but outside of that, where do you go to learn more right now at this stage of your industry and at this stage of your career? Where do you go, or who do you go to learn more?
So are you talking about specifically COVID, or are you talking about just growth?
Growth, professional growth in your industry.
Again, I'll go back to the Medical Group Management Association that I'm involved with. So they always have ongoing, there's chats every day. So I'm part of like 11 different chats that there always a different topic that comes up. There's always seminars going on. There's always an annual convention that you can learn more things, but it's also curiosity. It's not just this one association I follow, but I also follow the American College of Healthcare Executives. I also follow the American Medical Group Association. Then I also read about what changes there are in the insurance worlds, whereas insurance companies are always impacting reimbursements. So there's a couple of blogs that I follow about changes in the reimbursement. Healthcare has so many different tentacles involved with it. You have to follow the legislature both on a national basis and also the state basis, the county basis. You have to be aware of what's going on with CMS. You have to be aware of what's going on in the CDC. you also have to forecast what's going on in the other hemisphere. So usually if something happens in the southern hemisphere, when winter comes to the northern hemisphere, whatever those diseases are or flus, it's coming this way, and we have to be prepared for it. So it's, again, trying to do everything I can to be educated and prepared to lead my team to be prepared for the next chapter. So there's a lot of ways in healthcare. You can spend your whole day reading and keeping up with all the different things, and there's a lot going on. Like I said, then you throw in human resources, facility maintenance, the transportation, communication, IT, EMRs, and how to keep people safe from COVID. So, you can learn a lot. You have to be kind of involved and aware of what's going on in the world around you. And I think that goes back to what I was talking about a little bit before, is about curiosity. You always have to be curious about what's going on, because there's so many things that is going to impact the healthcare industry that you need to be aware of. What do you think, Cassie?
I agree. There's a Kentucky Health Department Association, Kentucky Public Health Association. There's so many acronyms, and this one goes by NACHO, but it's National Association of City and County Health Officials, and they typically have annual conferences where we try to attend and stay abreast of all of the public health information. This particular year, I feel like I go to CDC multiple times a day. Information changes so quickly. And the Kentucky Department for Public Health website, their COVID website, I go there multiple times a day. But again, like you said, you really have to be committed. Whatever field you choose, whatever field you're in, you have to be committed to being a lifelong learner. I actually miss being in class and getting the different perspectives, and so much so that I've considered going back for my doctoral degree or potentially another master's degree, because I miss that. Of course, COVID's made that different, but really, again, just being committed to being a lifelong learner. And I always say to my employees, you know what, you have the ability to change my mind. When you bring new information to me, we can change things. We always have to be flexible. When we know better, we do better.
But I think, I agree. I think the formal education is good to have that background. But I think that every day, if you're not learning something new every day, that's where I get the excitement. It's like, okay, think about the changes that we were learning about COVID, and what we did in the beginning and what we thought it was in the beginning. It's changed drastically what we're dealing with today and how we're caring for patients. And then from a physician provider world, the technology that we had to use to be able to communicate to our patients, similar to like this. We're Zooming. This is a Zoom meeting. We've had to learn how to interact with our patients and be able to diagnose them and treat them and listen to them electronically like this, which is completely different. And then throw that into a little bit more mix. Certain states prior to COVID, it was illegal to have a video interaction with the patient. So the legislature had to change, and we had to come up with processes, and we had to talk to the payers to say, yes, they'll accept this type of interaction and reimburse the providers for having this type of interaction. So it's been, a lifelong experience just trying to think through this COVID thing.
That's a great point. I know we've had to get waivers, to be able to offer our WIC program, which is Women, Infant, and Children, and focuses on the nutritional needs of the families. We're able to, we call it tele-WIC. So we can talk to these families over the phone, and we offer our HANDS program over the phone. Again, another acronym, but it's Health, Access, Nurturing, and Development Services. So a lot of policy changes have affected the way that we're delivering our services too. And there are actually 3 core functions of public health, and one of those is policy development. And a good example of that, seatbelt wearing, and then, restricting smoking in restaurants and things like that. So again, policy is something that affects both public and private health dramatically.
Okay, I have to know. Oh, sorry to cut you off. I wanted to know the other two parts of public health.
Oh,
Cassie.
sure. Great. That's a great question. It's assessment and assurance. And those go, it's a wheel, because if you make an assessment and there's a need, then you're going to make a policy to address it. And then you want to assure that whatever the policy change is, that it's being done. So maybe it's compliance reports with places that are not supposed to be allowing smoking, or, you know, things like that. Immunization reviews for schools that you're required to have certain immunizations for kids. So just things like that, which has helped save lives.
Yeah. Oh, I love it.
You know, the interesting thing that you're talking about is, like, when you're talking about policies and building policies, that you're interacting, you're networking with the other professionals in the industry, which I think is huge for all of us. I think that, you know, if you think about our interaction with our peers, how we share that information, we can grow personally, you know, best practices, sharing of best practices. It's so important that you build that network of peers that you can always call on and ask questions. And if you know, before COVID or whatever, you know, actually meet and have a cup of coffee and talk about, or you say, what are you guys doing about this? Or what are you doing about that? And I think the networking is huge, no matter where you're at. And if you're working in legislature, or you're working, you know, trying to make the best practices and taking care of patients. But I think networking is probably one of those huge things that we have, you know, for me personally, I've grown and have had a lot of benefits of networking with a lot of different people across the country.
I cannot agree more with that statement. We have a standing meeting with the Kentucky Health Department Association. It's actually a 4-hour meeting every month. And I always say there's no need to reinvent the wheel. And if someone's going through the same thing in an adjoining county, or even a county across the state, and it's working, let's just try to recreate that in our county or in our facility or whatever. So I agree, networking is key. So as quickly as you can, make connections, because they will be very beneficial in your success in whatever profession.
Yeah, and don't forget about them. You know, it's one of those things where if you can just, like, all of a sudden pull out your Rolodex or whatever and say, okay, I haven't touched base with somebody lately. It's one of those things that I always try to keep going through my list of people, just through LinkedIn or things like that, just kind of like touch them every once in a while and say how they're doing, and see if there's anything going on in their career that I can help them with, or their business and things like that. So I think continue, you know, you build that network, but you always have to, it's like a plant. So you have to water it so it continues to grow.
Yes.
So what recommendations do you have? So some of my students are a little nervous about this idea of networking, and some of them might consider themselves like introverts, and they're not really sure. And they're scared that networking means that you're going to walk into a room full of people and talk to everybody. What suggestions do you have for networking for those individuals who would feel extremely uncomfortable in that kind of situation, but obviously still need to make the connections and want to make the connections?
I'm an introvert. Very
You
much.
are.
But I'm also social. So I guess I'm an introverted extrovert. I'm not sure. And honestly, when I'm forced into situations where I have to make connections, that's the best thing. I know you've probably been to conferences where they assign you to a certain table, and they make sure that there are people at your table that come from different perspectives, different areas, so that you are forced to connect with them. Sometimes that stuff drives me nuts, but it actually pulls out great conversation. And then I think too, the Zoom platform, you know, you have the privacy of being in your own office, but also being able to connect and communicate with people. I think that's another great way to be able to stay inside your bubble, but also be able to share ideas.
The other thing is that people have to realize that everybody else feels the same way too. You know, most people, you go to a convention, you go into a meeting, or a reception, everybody has that same feeling. It's like, okay, who do I know? I need to find somebody I feel comfortable with. but that's one of those things that everybody has to do. You have to grow past that point and find 2 or 3 people. You don't have to meet everyone. You don't have to talk to everyone, but you need to make a connection somewhere. And it could be a simple conversation. There's got to be a reason that everybody's together, and you can talk about why are you here? You kind of break into those type of conversations. There's a lot of YouTube videos about how to be able to break into those conversations in a social setting, that gives you hints of how to start those conversations without looking like a weirdo. So that's always a good way to, if something was interesting, I need to go to YouTube and kind of hunt for how to do social interactions in a social event. But I think it's one of those things, again, it goes back to you have to realize everybody else is in the same boat as you are, and everybody's kind of uncomfortable. So you just start with one person and you just figure out who they know, and you just keep on going around the circle. And it doesn't have to be a deep conversation, but I think one of the things that you always need to do is at the end of it, you need to make sure you have a business card, either from work or a personal business card, and say, hey, here's my information. I'd love to talk to you later sometime in the future. So you always have that and try to solicit their card from there. It's one of those things where I've always been told that you have two cards. You have a personal business card and a business card. And you can give whatever one is appropriate at whatever the event is. So it's another way to continue to build that network, because you'll never know when you'll run across that person again, either as a volunteer, in the community or at church or through a chamber or through a state association. You came together for a reason, and then this will give you another opportunity to see them again. And you're like, oh yeah, I remember that guy's name or that girl's name. And it's like, okay, let me see, and try to make that connection again. And again, you just keep on reinforcing that relationship and build on the network. Networking, yes, as you think about the word, it's very scary, but if you break it down to the least factors, it's just talking to somebody. So, we've been talking for a half hour, and I don't know you I didn't know most of you guys before this, and so it's like we've had a good conversation so far. In my opinion, I'm sorry.
Agree.
Agreed.
Yeah.
And I really liked that. It makes me feel better just to know like everyone else feels as uncomfortable walking into that room as I do. I'm going to have to remember that next time. And be like, okay, everyone else feels awkward. Here's somebody. Well, I'll go stand by them so I don't look awkward and alone. So I like that.
Together.
Yes. And another thing that you mentioned is, networking through different things. So Cassie and I, we met through the chamber. We met through a women in business networking event, and I filed her away. And when I had this opportunity, I was like, great. Cassie and I really liked each other when we talked, and it was a really good, conversation. So
yes,
I was able to reach out and get you to join us tonight. So that's wonderful advice. I appreciate all of it.
Yeah, but I think the thing that I remember living in Lexington is such a social community, that whole Lexington, Woodford, Frankfort County area, and it's it has so many opportunities to continue to network with other people, because it's a very friendly social community, and everyone wants to help each other and help the community. So it's a good group.
Definitely. And there are some really great events, like the different Chamber of Commerce throughout our counties in this area are really great about hosting events to bring together. They're doing some things for emerging professionals, young professionals. They're doing things for people who are going through career transitions, and all of those things are really wonderful and super helpful. Okay, so you guys both work in public health and healthcare, so I have to ask the question, what's life like now that COVID has taken over your role? What is something that you never imagined would happen, or what's something that's different for you now? How have you adjusted?
I can take this one first. So I was used to working. We're actually by law the folks in our building, particularly 7.5-hour-a-week employees. My position's different, so I often have to work more. However, this is the 18th day in a row that I have worked plus hours, because the cases come in all of the time. And so that has been the biggest change. You know, I'm a mother of 5. My husband and I have 5 kids. And so that's been a challenge, you know, trying to adapt to the virtual learning environment too. But, you know, we've seen a pandemic like this in 100 years. And even though each of our employees, no matter what role they serve here at the health department, there are required trainings, they're FEMA trainings that basically give them the information that they need to be able to respond to any kind of public health threat. And of course, that fits that definition. So we have gone from offering certain services in a certain way to still being able to offer those services in a somewhat altered way, plus, again, doubling our workforce, but that has all been in response to COVID. So we have multiple layers. We have a disease investigator who leads the team, and then we have nurses and other folks that are they're actually following the cases, and then we have social support folks, because some of the families that have been infected by COVID may have lost their job. They may not have a thermometer. They may not have a pulse oximeter. So we are public health, and if they need groceries, we drop them on their doorstep. If they need a thermometer, we take that to them. The same way with a pulse oximeter. So again, being able to adapt is something that all of the students that are going to be able to watch this need to know. Things can change quickly, and your bosses are always going to be looking for the folks that adapt to change quickly and are going to be able to be a team player and do what needs to be done. That's actually been key in responding to this. You know, we're having to swab people. Typically, if you're sick, you don't come to the health department. We prevent disease. We're not health care. And so, you know, I'm not a nurse, but I've been swabbing people, something I never thought that I would do, to test for COVID. So again, very challenging time. This investigation, the investigations don't stop. It's constant work. And so we need people that have open schedules right now. But again, I want to reiterate that team players, your bosses are going to look, you know, they know they can go to you, and that you're going to be able to do whatever the agency needs you to do.
I agree. I think that, you know, COVID or anything else this is a chance for people to show their ingenuity, and don't wait for the person in the corner office to come up with all the answers. This is a chance where somebody's going to use their experiences and skills to say, okay, let's talk about the distribution of PPE or groceries or whatever you want to talk about. This is the time that, you know, it's truly a team project, and everybody needs to come up with, you know, what we can do to respond to the pandemic. You know, when we talked about, you know, from a physician standpoint, how to do electronic interactions with the patients, you know, we went through WebExes and DocsMe.me and Zooms, and, you know, some stuff that was embedded into our patient portal. And we just continue to keep on trying different methodologies to get one that was provided good service, that the patients knew how to log on to it, that was easy to use. So we had people from IT, we had nurses, we had physicians, we had you know, people from the community. And in our area, it's tough because it's once you get outside the city limits, it gets rural really quickly, and broadband is limited. So when you start thinking about all this stuff is internet based, a lot of people didn't have internet at home, that they had to go to a different site to be able to take the call or get on the Zoom meeting with their physician. Again, they still didn't want to come into the hospital or the doctor's offices, but we had to think about some of that stuff. And then I think it's just the protocols. Think about protocols of what we do. If we, when we opened an office, okay, so the protocols of making sure that we had somebody at the front door taking temperatures, asking the questions, having the patient sign that. You had single-use pens, so we had to go through the process. Do we have enough pens to give each patient the pen they use? That's theirs. They're taking it with them, or do we have enough wipes to wipe down every pen? Back in the beginning, the resources were so limited. Masks and N95 masks and surgical masks and Clorox wipes, and so you have all those different things that made it so impactful, and so we just had to come up with different methodologies to do that. And then once a patient walks into the lobby, we needed to make sure we had a process in place that we put them right into an exam room. We didn't really want them to sit in the lobby. We wanted them to go from the parking lot, get checked in, and go into a room. So we had to change our processes and had patients start, when they get to the parking lot, call, we check them in on the phone. And so when we're ready for them to come to the exam room, we called them and they came in from their car. So all these things were new and different. And again, we couldn't see as many patients because just that whole organization of getting people in and out of the parking lots, not having them share rooms together and things like that. So all that processes has changed greatly. So a lot of people being very curious and coming up with ideas and trying to figure out again how we continue to provide quality care and exceptional patient experience in an environment where is not what it was.
Bob, I'm glad you brought up PPE, because that was one thing that we were tasked with at Public Health with doing or distributing from the get-go. And I'm not sure what the experience was in your state, but in our state, we have regional distribution sites where the PPE was delivered by the federal government. And then we were then tasked with picking up the PPE and then distributing it locally, whether it be masks, face shields, gowns, hand sanitizer, disinfectant. So that's not something that it was in our emergency preparedness plan, but we never had to execute that before. So that's a great point. That was one way that public health and private health were able to partner in our state. And I'm really proud of those connections. And we were already meeting before it came to the United States. Back when we'd just been notified that there were cases in China, we established those partnerships with community members, EMS, law enforcement, schools, the hospital, in order to be able to effectively or efficiently get out the PPE that was needed. So that's another great point.
Mm-hmm. Yeah, I never thought of public health as being a distributor. You think about it, you guys were the distributor of all the PPE. That's something new and different that you didn't really expect. I'm not sure where agricultural background and education got into distribution of that type of stuff, but it has to be there someplace.
Somewhere.
I think it just has to do with you all, learning and getting what you can from your education and picking up, one of the things I love is seeing how lessons learned from different industries can impact my industry. And I think that that's something that you all were able to really learn through your programs and have continued to learn through your progression. Okay, so I'm going to wrap us up. Final question for you. Here we go. What is one piece of advice that you would give a student who is graduating in May and wants to follow in your footsteps? Big one.
Well, I think that is that one of the things that you have to do, I think we both talked about it, you have to be flexible. And you have to realize that doors will open up that you never expect to open up if you're doing the right things. We both said being helpful, being courteous, being inquisitive, being nimble. If you are exhibiting those things, and again, being involved, Cassie, you just talked about how you were involved with all these different entities, the EMS and the different people when you distributed the PPE. Think about all those people that you come across in the different ways that you are doing your job. You never know when that door will open up. And if, people see that you are not one of those people that says, oh, my job is, I'm here from 7:30 to 3:30 and an hour and a half off for lunch, but don't ask me to work anymore. But you're the person that comes in early, you stays late, you volunteer for things, you continue to try to be helpful and be involved. Those are the people that's my suggestion to everybody. Don't be narrow with your thought of my job is only paying me for this amount of time. Go the other extra mile, and it'll pay off in the long run.
Absolutely. Adaptability, flexibility, teamwork, those are all things, those are great attributes. One thing I would say, again, I've said this a few times in a few different ways, you might not get that dream job out of the gate, but be open, because you know what, you might get that job and it might not be in the specific area that you studied in, but it might be something that takes you to your end destination. But I will say, when hiring, one of my first things I do when I get applications in is I go to social media and I search that person and I see what their profile pictures are. Is it of them like with 2 bottles of beer or, whatever. I do that every single time. And it's been very effective in weeding out some of the folks that I think might not be a good representation for the health department. Again, I know that's their private page. However, it is a reflection. And when you work for an agency, you need to be a reflection of that agency. So I would definitely monitor your Facebook page, things you are tagged in, that you might not want to be connected to, that your employers probably don't need to see. But again, just being open, adaptable, flexible are all things that are going to benefit you in the long run.
Perfect. Well, I appreciate both of you for hitting pretty much all the high points of every bit of coaching I give students on monitor your social media, get the right social media going. So get your LinkedIn up and going, get your networking started. So, and get internships. So all of the things that I'm coaching our students through. I appreciate you guys. Your check's in the mail. You'll be getting that soon. And I'm just going to go on and wrap this up tonight. Thank you both so much for joining us and for sharing your experiences and for being willing to shed some light and give some coaching for our students. So I appreciate that so much.
Thank you for inviting us. And it was good to meet you, Bob. Maybe our paths will cross again.
Yes, probably. All right. Thank you.
Have a good night.
You too.